I'm Krista. I'm a level 1 nursing student.
Hey.
I was wondering if you would give me the SFAR report on your patient.
Yeah, no problem. So my patient today is Mr. Ryder Kind, and he's age 67, and he's a male, and he's in room 620 right now. He has no allergies, and he's full code. And his admitting doctor is Dr. K. Phillips, MD, and he was admitted on Tuesday, 1600. His primary diagnosis is a stage 2 diabetic ulcer on his right heel, and his secondary diagnosis is type 1 diabetes mellitus, and he was diagnosed with that 20 years ago, and he's been taking insulin ever since. He was admitted to the medical unit with a non-healing diabetic foot ulcer and hyperglycemia. And he also stated he wants education about his diabetic diet so he can maintain his blood glucose levels a little bit better. So he denies headache, but he says he has tingling in his bilateral lower extremities, and it's worsened in the past 3 months. So we did a pinprick test, and he feels no sensation in his bilateral lower extremities. But he has steady gait, he has perla, and he's alert and oriented ×4. His lungs are clear in all lobes to auscultation, and his breathing is unlabored without using his accessory muscles. His heart sounds S1 and S2 are present without murmur, rub, or gallop, and they're at a regular rate and rhythm with no carotid bruits. He has a flat abdomen that's symmetrical and soft with no tenderness. He has bowel sounds present in all 4 quadrants with no ascites and no bruits. He denies flank pain or urination problems. But right now his diet, he's on his 1800 calorie diabetic diet with a 2 gram sodium restriction. And so that's what I'm going to talk to him about his diabetic diet.
Okay.
And about his wounds. So it's a stage 2 diabetic ulcer, and he noticed about 3 weeks ago, and it has been healing. It's increasingly painful, and he tried to do some home care with salt water, but it didn't help at all. The wound size is 5.5 centimeters by 2.5 centimeters and 3 centimeters deep. And the dressing order right now is to cleanse it with a normal saline rinse and put a dry sterile dressing on there. So for his labs, his albumin is 4.2, and these labs are all taken on Tuesday at 1600 when he was admitted. And his white blood cell count is 5,000, and his hematocrit is 41.2. And his A1C was taken 3 months ago, and it was 5.2%, but his blood glucose levels was about 120 around then, and they've gone way up since then. So I was thinking probably get another A1C test. He does have a IV site on his right forearm, and that's his median vein. It's a peripheral IV. So the medications he's on right now is simvastatin, gabapentin. He's doing insulin, and he has a morphine PRN. And his vital signs last taken was on 1645. His heart rate was 76. His respiration 16 with a blood oxygen of 96%, and 128/70 was his blood pressure. And then at that time, they took an AccuCheck, and his blood glucose levels was still at 290. So I'm thinking we're going to have to give him his insulin shot.
Okay, cool. So I just have a couple questions for you.
Yeah.
So why specifically is this client receiving this medication, and what action does it have on the body?
Well, he has diabetes mellitus type 1. So his body can't make his own insulin, so he needs to get it from an external source. So he needs it to facilitate glucose going into his cells from his bloodstream, along with amino acids or potassium.
Okay. And when should you question administering insulin?
If somebody is hypoglycemic, when you check their blood sugar, it's really low, or if they're showing signs of hypoglycemia, or if they have some sort of allergies to the insulin.
Okay. And does the medication have a therapeutic serum level, and which vital signs should be monitored?
Well, you always want to check all the vital signs, but specifically you want to check his blood glucose levels to make sure he's not hypoglycemic before you give it to him.
Okay. And what interventions must be taught to the client to ensure the medication is administered safely in the hospital setting? And what interventions must be taught for taking the medication safely at home?
Well, first of all, it starts with your supplies. You want to make sure you have clean needles, they're not using them all the time, and they're clean. And then also insulin that's not expired. And you want to check your insulin before you administer it. And then for the sites, you want to rotate all your sites, your abdomen, your arms, and your thighs, so you don't have irritation to if you use one site all the time. And then also you want them to check their blood sugar every time before they administer the insulin. That way they don't go further into hypoglycemia. And yeah, that's about it. Just look out for signs of hypoglycemia and if they have allergic reactions.
Okay. So what are the side effects and potential adverse reactions?
Well, the main one is anaphylactics, if they're allergic. And if they go too far into hypoglycemia, then, yeah.
Okay. How will you know the medication is effective?
Well, you want to check their blood sugar after and to see if it lowered into a safe level.
Okay.
Any more questions?
No, that's it. Thank you.
Okay, let's go in there and give him a shot.
Okay.
His injection, actually. All right, level 1 student, that's how it's done.
Okay.
You want to wash your hands before entering the patient's room. You want to give a little knock, give a little warning.
Hi.
Hi, I'm Joe. I'm your nurse today.
Okay.
What's your name?
Ryder Khan?
Oh, okay, awesome. And do you have any allergies?
No.
Okay. Well, I checked your blood glucose level, and it was 290, so it's a little high. So I'm just gonna give you your insulin shot. Is that okay?
Yeah.
Okay, awesome. Cool. And also, I saw on your chart that you had some questions about your diabetic diet.
Yes.
Okay, so I was just give you some information about that, and just also about giving insulin. Do you have any other questions about insulin? Or?
Yeah, how often should I be checking my blood glucose level at home?
Oh, you definitely want to check it before every insulin shot, and before and after meals.
Oh, okay.
Things like that. Okay, cool. So I'm gonna do a little scan here. Make sure you're right patient. And I'm gonna pull up the doctor's orders with the MAR and then compare and make sure it's the same orders. And looks like today you're getting your Humulin, your regular insulin. It's a short-acting insulin. And looks like since your blood glucose was at 290, the sliding scale says you're gonna get 16 units of that. And how was dinner today?
It's good.
Okay, awesome. So, and then I check the dose, there's the medicine, and it's the right time, right? Yep, it's the right time for the medication and the right patient. Cool. So, I'm gonna put on some gloves. Oh, let me just grab my gloves real quick. So how's your day going?
It's going all right. How about you?
Awesome. It's busy, but you know what? I have a great time doing it. So I'm going to pull out the medication, and it's regular insulin. It's a Humulin injection. I'm just going to compare it, and I'm going to give 16 units, and it's the right time, and the right patient. Mr. Ratterkind. And what's your age, sir?
67.
Okay, 67. Awesome. And I'm going to check the expiration date. Looks like the right expiration date. Yep, it hasn't expired. Right time for it. So I'm going to grab my syringe. And alcohol pad. top a little wipe. Make sure it's all clean. There's 16 units of air. Units. And do the scoop method. Awesome. So now I'm going to do another check. I'm going to scan the medication as dropped. And I'm going to scan you, sir. Just your arm there. Thank you. And it's the right medication. It's the right time. It's the right dose, 16 units. Yep. And right, right route. It's a subcutaneous. Okay. Awesome. Where would you like your injection, sir?
In my tummy.
In your tummy?
Mm-hmm.
And do you rotate your injection spots?
Yeah.
Okay. And then you can also do it on your back of your arms and your thighs too, to prevent irritation.
Okay.
Okay. So I'm gonna grab a alcohol pad. You say the right side of your tummy or left?
I alternate.
Okay. So I'll do it on your left side this time. I'll give you a little pinch. Lock it. Dispose of it. My hands a little washed. And then I want to do some documentation, get everything ready. Okay, sir. So you wanted to have some information about your diabetic diet?
Mm-hmm.
Okay, so for your diet, you're not going to want to skip any meals. And you want to have about 3 meals every day with a snack at the nighttime. And it's 1,800 calories. So you're going to look at all your food labels and count your calories, make sure you're eating the adequate amount of food, and then make sure you're making the right choices. So when you eat, you don't want to eat high sugar foods, like sodas or cakes or candies and things like that. Also, you want to get a high fiber in your diet, about 3 grams. And for meals, you want to get a protein and a carbohydrate each time you have your meal. And for your carbohydrates, you don't want to get more high fiber foods, like whole grains and things like that.
Okay.
Do you have any other questions?
No, I don't believe so.
Awesome. Okay. Well, thank you, sir. You need to make sure your bed's lowered, give you your call light. Is there anything else like you like around your room?
I'm good.
Okay. Well, I'll be back and check in soon.
Okay.
Alright, so I'm going to grab my computer for the documentation and let's step out.
Thanks for letting me watch that. I
Yeah,
had a
no
couple
problem.
more questions for you.
Yeah, sure.
So were there any pertinent pieces of information you reviewed before administering the client the medication?
Yes. I wanted to check his blood sugar because that would tell if I would give him a shot or not.
Okay, and did this information affect your decision to administer the medication?
Yes, because if he was hypoglycemic and his blood sugar was too low, then I would withhold the insulin.
And did this information affect how you administer the medication?
Yeah, because using the sliding scale, I referred to his last blood sugar check before I gave the medication, and since it was 290, that I referred to it and I gave him 16 units.
Okay, thank you so much.
Yeah, my
I
pleasure.
learned a lot today.
Yep.